Hello, everybody, and welcome to another exciting episode of the Cardioseeds Podcast. I'm your host, Dr. Chamoun, and today our key topic will be the conversation about survivorship and using lifestyle medicine to boost hope, wellness, and resilience to both our patients and our healthcare professionals. And I'm thrilled to have a remarkable guest expert with us today, Dr. Amy Comander. Dr. Comander is an accomplished breast oncologist. She is a director of breast oncology, cancer survivorship, and lifestyle medicine at the prestigious Massachusetts General Hospital in Boston. Dr. Comander is well known for her compassionate care and her avid devotion to her patients. She has a strong interest in cancer survivorship and lifestyle medicine, and she's dedicated to improving the quality of life and outcomes for cancer patients. Dr. Comander's achievements are numerous, and you can find her bio under the podcast description. And I'm genuinely excited to delve into our conversation today. So, Amy, welcome to the Cardioseeds Podcast, and thank you so much for joining us today.
Thank you so much for inviting me. I'm so happy to be here.
So before we explore your work on cancer survivorship and breast oncology, let me ask you about your journey to this point. You're a Yale medical graduate. You're a Harvard-trained oncologist. What led you to focus specifically on breast oncology, cancer survivorship, and lifestyle medicine?
Such a great question. And I love exploring other colleagues' journeys too for how they found their specialty. But for me, to be honest, I never thought I would be a breast oncologist. If you talked to me back when I was an undergrad, I was really passionate about the field of neuroscience and actually thought I would be a neuroscience researcher. In fact, as an undergrad, when I was at Harvard, that was the beginning of something called the Mind, Brain, and Behavior Initiative. So we major in something related to under that initiative. So I was a neurobiology major under that mind, brain, and behavior program, and did research in neuroscience, took every class I could take. And when I started out at Yale Medical School, I was doing research in a molecular psychiatry lab. So it's kind of funny how eventually, when I made it to my clinical rotations and did an oncology elective, I realized that I had this strong interest in learning more about cancer and how to treat cancer and help these patients who were facing these very scary diagnoses.
Yes.
At that time, there were so many advances in the field of oncology, and that's sort of what drew me in. And then I found lifestyle medicine much later, actually. Actually, after my training, I found lifestyle medicine through attending a conference.
And when did that happen?
Yeah, so I was a breast oncologist, at Mass General. And honestly, this is now about 10 years ago. I happened to see a flyer that, there was this lifestyle medicine conference being held. It was in June of that year, sponsored by Harvard Medical School. And I went to the conference because I'm really interested personally in exercise and plant-based diets, et cetera. And the whole conference was really focused on how do you write an exercise prescription? How do you discuss nutrition or sleep habits with your patients? And I actually met Dr. Beth Frates at that conference and heard her speak. And I was so inspired by the incredible work that she was doing that I met her after that conference to learn how I could use these tools to help my breast cancer patients.
That was a faithful meeting, right?
Yeah.
And we will talk about your work together with Beth Frates, Dr. Frates, a little bit later today during our conversation. But before doing that, I want to ask you the next question about the concept of survivorship. As a lifestyle medicine advocate, you've seen this positive impact on cancer patients, lifestyle medicine on cancer patients. So can you explain the concept of survivorship and how lifestyle interventions can supplement traditional cancer treatments? Is there evidence-based behind nutrition, exercise, and other pillars of lifestyle medicine, like avoidance of alcohol, to reduce the initial risk of breast cancer and reduce the recurrence and perhaps even affect the survival, intervention that affects survival?
Yeah, that's such a great question. And I will say that, there's increasing research, mostly from observational studies, but also, of course, now large meta-analyses really demonstrating that adherence to certain lifestyle interventions has been shown to be associated with a reduced risk, certainly of breast cancer, which is my specialty, but also other cancers.
Mhm.
And then for cancer survivors, adherence to these lifestyle factors has been shown to be associated specifically with a reduced risk of breast cancer recurrence and overall mortality. And I'd love to share with you one study that was just published actually in May 2023 in the journal JAMA Network Open. And the first author was Dr. Canioto. And essentially, this looked at a high-risk population of individuals with breast cancer, about 1,300 women,
Mhm.
and found that in this group, the group who adhered most to the recommended lifestyle recommendations, such as don't smoke, eat lots of fruits and vegetables, stay at a healthy body weight, be physically active, avoid alcohol, avoid sugar sweetened beverages, avoid red and processed meats, etc. Those who adhered the most to those lifestyle recommendations had a significantly reduced risk of recurrence and improvement in overall mortality. So, and they assessed these individuals at the time of diagnosis, during treatment, and 2 years after they initiated their treatment.
2 years.
Yeah, so that study, was published in May, and of course, we'll have longer term follow-up of those individuals. But that's just one of many studies really demonstrating the power of these lifestyle tool interventions for improving outcome, specifically focused on breast cancer, but we're having more data now focused on other cancers as well.
Mm. So, what was the profile of the patients in this particular study that you just quoted?
Yeah, so this was part of the study called the Diet, Exercise, Lifestyles, and Cancer Prognosis Study, also known as DELCAP. And these were considered higher risk patients. How
Mhm.
is that defined? Based on their stage, the molecular features of their tumor, et cetera. And so they're all, women who had a diagnosis of breast cancer. And so, again, I look forward to seeing further follow-up beyond 2 years of this population. But really, I love it as a great demonstration of adherence to these lifestyle interventions and showing significant benefit. And I should say that these are recommendations that are very commonly recommended by the American Institute of Cancer Research and the World Cancer Research Fund, which are two large organizations that do significant research on the role of lifestyle in cancer prevention and for survivorship.
So the research started a while ago, right? Because there are multiple publications on this topic. And I was wondering when it started, when did it launch? When did they start launching this research? And also what I was thinking, what is the if you cannot follow all the recommendations, right? You said that adherence to all of those recommendations makes the best sense or yields the best results for our patients. But if they cannot follow all of them for whatever reason, right? Maybe some limitations to exercise, etc. What would be your best choice to tell them, hey, this is the combination. Like, if you can't follow everything, just do this and you have your best chance.
Well, if we're thinking about reducing risk of cancer in the first place, we do know that of all the lifestyle factors out there, tobacco smoking, unfortunately, still is the greatest risk factor for cancer, certainly in the United States, and that could account for approximately 20% of cancer risk in this country.
Wow.
So if we can eliminate smoking, which of course is also a key pillar of lifestyle medicine, we would make a significant dent in the diagnosis of cancer in this country. After that, other important lifestyle factors, of course, are attention to body weight. We know the obesity epidemic is a major problem in the United States and around the world. And unfortunately, adult weight gain contributes to increased risk of many different kinds of cancer. Thus far, we think it contributes to risk of 13 different types of cancer. So a focus on body weight is also key. But other key aspects to focus on are alcohol consumption, our diet in general and thinking about avoiding a lot of this ultra processed food, which is unfortunately quite prevalent in our standard American diet. And then, of course, the need for increased physical activity. So all of these factors are so the number one is definitely, when we're thinking about cancer risk reduction in general,
smoking. I cannot believe people still smoke, Amy. It seems to me that this is so intuitive and so well known now that smoking actually kills, right? But people still
it's
smoke.
still the number one. And then, of course, obesity is right after that.
Yeah. So speaking of obesity, actually, I wanted to, dig a little bit deeper into this. What is the mechanism of fat or fatness or obesity, whatever I call you, right? Causing cancer and the reverse. And what's the ideal BMI, if such thing exists, to keep the risk at minimum?
Yeah, such a great question. And I think we're learning more and more about the mechanisms by which obesity, unfortunately, can increase cancer risk, and particularly a focus on weight gain in adults. Like that is a major risk factor. But some of the mechanisms that are hypothesized to explain this are, obesity causing an inflammatory state in the body, certainly insulin resistance, suppression of the immune response, oxidative stress, DNA damage. There's all these potential mechanisms that are being studied to help us understand, how obesity is contributing to this increased risk. And certainly, if we just want to focus on breast cancer for a second, we do know that, postmenopausal obesity in particular, a focus on postmenopausal is definitely a significant risk factor for breast cancer. But again, when I mentioned 13 cancers, there really are 13 cancers felt to be potentially related to obesity. So we really, certainly in our field of lifestyle medicine and in our other colleagues in the fields of obesity medicine, et cetera, we all need to work together to figure out how to really address this problem.
What about stress affecting breast cancer risk? I'm not even asking about other cancers. Let's just focus on your specialty. I'm, as a cardiologist, I'm well aware of chronic severe stress and burnout being a major risk factor for cardiovascular, disease of various kinds, right? I even started this work-life balance and cardiovascular health subcommittee with the cardiology member interest group of our American College of Lifestyle Medicine to just pursue that specific part to try to see what factors can be affected. I mean, on what factors we can work as lifestyle medicine physicians to reduce stress, burnout, and cardiovascular complications in the long run. But what about cancer? How much stress and burnout plays role in that specific thing?
All right, well, first of all, I just want to commend you on the amazing work you're doing because it's so important. And
thank you.
But I know we both are very interested in addressing physician burnout or healthcare worker burnout in general.
We sure are.
For all the work that you do.
And you too. The compliment is mutual, my dear.
But I mean, I know the stress and cancer relationship is a complicated one. And certainly, I find that the way I usually think about it is that when we're feeling excessive stress in our lives, often that does lead to a lot of unhealthy behaviors. And this is the kind of thing I've seen certainly in my patients. We talked about smoking, we talked about drinking too much, we talked about weight gain. Certainly over the course of the pandemic, we know that there was such an increase in alcohol consumption in the general population, lack of physical activity, unfortunately, poor eating habits. So I think there's so many factors that are intertwined. I think it's really hard to say that stress itself is a risk factor for cancer, but I think the association with so many other unhealthy behaviors, which are known cancer risk factors, is another reason we really need to find ways to address that as well.
Right. So how do you address that survivorship thing with your patients? When do you start? What's involved in it? And how do you progress with them? I understand this is not a one-time thing. It extends throughout the lifespan of cancer survivors, right? How does the program work?
Right. So, I mean,
and who benefits? I mean, patients are referred probably to you guys from everywhere in the country, right? I know that other institutions also, like Mayo, have their own programs. So that's where Dr. Dawn Musalem runs one of them. Yeah, but what's happening at your institutions, Mass General?
Yeah, so my main job is I'm a breast oncologist, and I'm seeing patients at all different stages, from the time of diagnosis, treatment of early stage disease, treatment of advanced disease, and sometimes I'm seeing individuals at very high risk for breast cancer, whether that's due to a known genetic mutation, family history, or other factors. But what I noticed when I went to that lifestyle medicine conference again about 10 years ago, I was like, wow, these tools have such power for cancer survivors. And even at my hospital, an amazing academic cancer center with so many resources, we have so much more we can do to help our patients after they've completed primary treatment for breast cancer. And I can just tell you, our patients go through so much when they go through treatment for breast cancer. Surgery, often radiation, often a need for chemotherapy, now targeted therapies, immunotherapy, and often endocrine therapy, depending on the type of cancer. So our patients really go through so much, often sometimes well over a year of treatment. And as you can imagine, these treatments do take a toll, and our patients are experiencing numerous side effects, both early side effects and late side effects from their treatment, and they do need to be well cared for and monitored. And many times when we see a patient at the end of treatment, I'm like, you did great, Mrs. Jones. I'll see you in 6 months. And you can imagine a patient is like, 6 months?
6 months, it's lifespan for them. Yes.
So that's when I was like, we need to be doing more in cancer survivorship. And that's sort of where I wanted to really start some kind of breast cancer survivorship program. And it just so happened that I went to this lifestyle medicine conference and was like, this is what I want to do. And I happened to meet Dr. Frates and met with her shortly after that conference. She was so generous to meet with me. And I remember at that time, she had started this program called Paving the Path to Wellness for Stroke Survivors.
Yes, for stroke. Okay.
So she works at the Spalding Rehabilitation Hospital, which is a Harvard Medical School affiliated hospital right nearby. And she was doing this program with stroke survivors, which we know, that is a very traumatic thing. And our patients, those individuals certainly need these resources as well. So we started a collaboration at that time, and I was so excited to adapt the program for breast cancer survivors. And that's really how it started. And she was so generous with her time and knowledge. Remember, I knew nothing about lifestyle medicine. Okay. I was a runner, and I was.
Hey, you're a quick learner.
That's basically it. I did not know what motivational interviewing meant.
Right. Yeah. Tell me about it.
I was like, stress management? Anyway, sleep? Okay, you get the idea. So I did not know much, but at that time I was really excited to get involved and learn more. And I learned some Brady's and of course some other colleagues, and I've attended many conferences since then. To make a long story short, we did launch the paving program pre-COVID. I know it feels like a long time ago now.
Oh yeah. And then transferred everything online, right?
And the patients, I can just tell you, it's been, I wish I could have one of my patients join us to talk about it, but it's really been life-changing for so many participants.
We should do that. Yes, we should do that.
Okay,
you gave me a great idea just now.
I absolutely love the opportunity to share with you. But really, for me, I know your major interest is also how we help healthcare providers address burnout. For me, so rewarding to run this program in this wonderful in this field, and it's just been love it. And now we have a whole team working together so we can offer to more of our patients.
So did you have to tweak the program to breast cancer patients, or you just kind of took that stroke program and just started using it? What did you do with it?
And so Beth had this original idea as a 12-week program. And of course, we focus on the key 6 pillars of lifestyle medicine, but we also incorporate other important topics such as how one sets goals, thinking about incorporating variety into your life, with whether that's nutrition, exercise, etc., thinking about sense of purpose and the social connection piece. So the program's actually 12 weeks with more of these topics, and we dive into each topic in great detail. And in order to make it really relevant to our patients with breast cancer, I certainly share what the latest data shows. For example, why is exercise important for breast cancer survivors? Why do we recommend a plant predominant diet? How do we manage stress? So we kind of dive into those topics with a focus on how it's relevant specifically to a breast cancer survivor
To
population.
breast cancer, yeah, I can imagine. You know, that what you're saying, it reminded me how I created Cardioseeds and how
Yeah.
it evolved, not only Cardioseeds, but the Reclaim by Cardioseeds program. You know, we take everybody, whether they are healthcare professionals or whether they are patients, and I do a very similar thing with them. You know, I engage their creativity. They do lots of journaling. I encourage them to, you know, to do reflections. I send them to what I call a hard reset, 2 days or a weekend without any, you know, attachment to television or social media. They just sit in there, you know, walking around with a journal and a pen. So,
Wow.
and just write in their, you know, reflections, their thoughts, and we talk about reinventing their purpose. We talk about, you know, all kind of lifestyle, you know, modifications they may need, but mainly refocusing on their, you know, specifics. If this is a healthcare professional, for instance, they may have a lot of burnout and work related issues, you know, workplace. So we consult them on work-life balance and how to restructure their teams and what resources they may have and what this is all about, you know, the background of modifying lifestyles one at a time and modifying workplaces one at a time. So it's a fascinating journey, but I'm like very fascinated that people at various places, various parts of the country, at various stages of their professional development, like you and Beth and I, much later than you guys, find similar kind of similarities in our work and our approaches, right?
What a great program. And the people who take your program, I'm sure they derive such benefit. I love that creativity aspect too. And
Yes, yes.
the power of like really learning about lifestyle medicine. Cause I don't know about you, but I can tell you, like, and when I was in medical school, kind of embarrassed to say this, but like the nutrition lectures were kind of optional in the evening. And I will tell you, I don't know if I went to all of them.
I hear you. I hear you.
Like,
We did not have any of this. So we had mainstream medicine, no lifestyle, you know, lifestyle knowledge or education at all. I'm a graduate of a Ukrainian medical school, so I had to retrain here. And so I went to, I had my fellow residency at the University of Virginia program, and then my fellowship here in Philadelphia. And then, you know, I was dreaming about becoming an interventional cardiologist, so the whole thing. But again, Amy, hey, we're talking about the 90s, right? The 90s when lifestyle medicine wasn't even on the horizon. It was not on the horizon. So we had to be contented with whatever we had. And interventional cardiology was on the rise then. And I was like fascinated. But you know what happened to me? Life made a correction for me. So I started having back pains while standing during those long procedures in the cath lab, right? So I had to really think hard what's going to happen to me. And then the Temple University Hospital, they opened a brand new imaging fellowship. So they invited me to be their first fellow. They probably saw I could do it all. So they said, hey, Lana, can you come and just, are you interested in becoming our first fellow? And I said, okay. I can do that. So I got stuck with imaging and all that stuff and, you know, practiced for many years that. But, you know, Amy, what I had to tell you what happened to me. I not very frequently tell people what happened to me. I came to the point where I am now through a chain of misfortunes and obstacles, I should say. So when I came, you know, we were in Ukraine and then the country fell apart, essentially, the Soviet Union, right? The Soviet Union. And then my city got overran by gangs, essentially, that we're talking about 1991. and I had to leave the country. I could never imagine that's what happened to me, because I was cushy, I had my PhD at 25 already, and I was on the track of being a full professor at some point. So they just appointed me as an associate professor at 26.
Wow.
And then everything fell apart, and I had to leave as a refugee, Amy. I left with, literally speaking, when people say they came here with no money, I can tell you, I had less than $400 in my purse, not in my pocket. That's the difference. People say I had it in my pocket. I had it so I had $360 in my purse and nothing else, and no language, nothing. So, but what I had was education that I had. My parents, I was the only child, and they really invested everything they had in me. And, as turns my grit, because after I came, my dad committed suicide back home. So I learned about it about 6 months late, 6 months after my arrival. And that really kind of destroyed me mentally, right? And physically. And then I lost my husband. My then husband, I lost him, right? And our kids were still in Ukraine, and I was, literally speaking, fighting for survival to get my citizenship and everything. 5 years I haven't seen my kids, for 5 years. Yeah, and I thought, I really didn't have a job. I didn't have anything, and was working like random jobs and all that stuff. But God's, God protected me, I must say. And then I had a major burnout when I was in clinical job, my first clinical job here on the main line of Philadelphia. It was a dream job, Amy. Dream job right after the fellowship. Excellent hospital, perfect team and everything. But, I felt isolated. I was a single mom. I had 2 kids, and I was doing it all by myself, 14-hour work days, raising 2 kids on my own, and fully supporting my mom in Ukraine, who fell apart after my dad committed suicide. So that was my kind of path. I remarried subsequently, and it was great because it was my husband who is a full-time practicing cardiologist. He gave me that brochure that you found for yourself, the Lifestyle Medicine annual conference. And he said, you may be interested in this. So this is how twists and turns of fate bring people to where they are. And, I became board certified, and I certified as a a health and wellness coach also subsequently. So, and then when COVID started, you said during COVID, you launched a program. When COVID started here, I was on my second job in my career as a cardiologist, as a chief cardiologist for the world's largest technology and innovation company. We did clinical trials, running clinical trials for big pharma. So I spent 14 years on that job. And then I saw this medical community essentially falling apart around me, right? My former colleagues, friends, and my own job that, I was a chief cardiologist, but we had to restructure wellness programs. I was working with our HR to help them to restructure wellness programs, et cetera, et cetera. And then it was like a strike of lightning. Hey, I can do it on my own. I don't need this employer anymore, and I need to make my contribution to helping healthcare professionals and helping patients, because I realized, I don't know, it probably was you as well, who we all realized that a lot of those deaths and complications, COVID-related complications, could be prevented had our society been, healthier, right? And had our healthcare system be more efficient, running the show, right? And the doctors less burned out. It's turned to be that the background was already there, that doctors were languishing, and then essentially started crumbling, right, like this. So then I started Cardioseeds, and the rest of his is history. So essentially,
Wow.
yeah, the story I
Yeah,
tell people,
I
infrequently.
know about your story, and like you are like, I mean, you are the most resilient person I've ever met. Imagine if you face
Yeah, I mean,
incredible
not
things.
not really, not really. I have my moments, but
Hard
it
things.
really tested my resilience, and it really tested my will to live in general, And then my mom passed away during COVID in Ukraine, and then 2 months later, the war started. So it's like the whole thing is just but this is the purpose. The purpose, I think, is important. When you define your purpose and when you define your place among your colleagues and in medicine in general, and have this clear idea where you can contribute, right? I think this is the most important thing, and that really keeps me afloat no matter what. Because I think, as many people say, that happiness is kind of a reaction, right? But joy is internal, and it independent essentially from the outside circumstances. So that's what I learned hard way, but nevertheless, I'm happy that I know those things now. So yeah, well, let's talk
Thank
about
Wow.
lifestyle. Yeah. Um, I want to ask you about the lifestyle medicine pillars that you would recommend, as we speak about burnout and all these hardships and all that stuff. So,
Sure.
what lifestyle medicine pillars you recommend to use to boost hope, to boost that resilience? And, for those cancer patients who are depressed, who are seemingly, losing hope. I mean, we can translate it to our healthcare professionals, of course, because there are so much burnout and suicidal ideations and depression among nurses, doctors, and other healthcare professionals around us. So what would you tell people to do when seemingly they start losing hope?
Yeah, it's such a great question. And certainly we do know that um, depression, anxiety, stress, all these other, those diagnoses as well, so many other psychosocial concerns are very, very prevalent among cancer survivors. And obviously, in general, there's just not enough mental health resources out there to help everyone, including the cancer patient population. So these are topics that are very important for us to address in clinic. And certainly that's part of my clinic visit with each of my patients to see how they're doing from a mental health standpoint. I will say, just based on my experience with the paving program, you ask about the pillars of lifestyle medicine, and kind of have a little bit of a funny story. So when I started the program, and I would be interested in your comments about this too from your program, but when I started the program, I was so excited to share the latest data about what is the role of exercise for breast cancer survivorship. What does the data say regarding sleep management and how we address insomnia in cancer survivors? You get the idea, all the interesting data and like the studies. I was so excited to share all this. And of course, the participants loved learning all this information and how they could potentially adopt these tools in their own lives. But what do I think is actually the greatest gift of that program and the number one pillar of lifestyle medicine, if you surveyed the women who have been in the group? Social connection. Okay.
Oh,
So
yes.
I will tell you that when
Women, yes.
I've shared this before when I've given talks, but like when the first group ended, it was 12 weeks.
Yeah.
And I'm like congratulating everyone. You did it. You did the 12 weeks of the paving program. Yay. We're going to give
They
you a
say we did it, right?
and I'm like also secretly patting myself on the back, like, you led a group visit. You've never done that before. And you were scared, but you did it. And then the funny thing is, one of the participants, and she won't mind if I use her name, Linda Wolf, who's like a leader in the program now, she kind of raised her hand. She's like, Dr. Comander, we are not done.
And you're like, oh.
those women had bonded so much. Yes, they loved learning about exercise and plant-based nutrition and sleep and stress management and sense of purpose and all that stuff. But what they really loved was like meeting other women who were going through the same thing. They all really understood each other. They loved being together and being accountable to each other.
Yeah.
And from that time, to be honest, back in 2019 until now, 2023, they have stayed like this. They call themselves the Originals. They were meeting in person, and then COVID happened. They started meeting on Zoom twice a month. I think they're still meeting on Zoom, but they're each other's support network. And so they would probably tell you the supportive community that's evolved, greatest gift of the program.
Yeah.
So social connection way up there. Way
Yeah. Yeah, yes, of course. I learned it also with my patients. I call them clients. I don't call them patients.
about that too.
But the thing is that the original Reclaim program that I created was individual. And then I said, because the original one was for healthcare professionals, and I was concerned about privacy.
Yeah.
And I was concerned about, especially local physicians and nurses showing their faces, et cetera, et cetera. But then I said, let me try to do the group therapy, small, very small groups. My dog is scratching the door. I can hear. So if you hear him, don't pay any attention. It's just a 5-pound Yorkshire Terrier who is 14. So and then I said, let's try the group therapy and see what happens. Small groups, 4 to 8 at most people, and physicians, Tichka, stop it. Physicians were reluctant to do that. So the majority of my physician clients remain in individual programs. But other healthcare professionals just jumped on that. Nurses, they want, everyone tells me that they love to talk not to a therapist, but to a person who can relate to their problems, personal, work-related, etc. This is why physicians, they love to talk to me, because I know I went through this myself, right? And I know the hospital, I know the administration and all of those interactions, etc., etc. So they say, it's so much better to talk to you than to regular therapists, because they just don't get it and you get it,
Yeah.
But nurses, I mean, when I was in medical school, Amy, we were in Ukraine allowed to work as nurses, starting after the 3rd year, when we started our clinical medicine during the 3rd year. We had 6-year track in medical school, not 4 years, because the first 2 years were pre-med and they were incorporated in education in medical school. So we didn't have to have this additional 4 years of college, right? It was 6 years and you're done. So the thing is, after the 3rd year, we could work as nurses. And of course, students always need money and all that stuff. So both my husband and I worked as nurses. He worked in intensive care, and because he became a surgeon later on. And I was in oncology, GYN, not breast, GYN oncology, 70 patients. 70 patients, a huge, we had a huge regional hospital, referral hospital, because we were the regional center, like we were the analog of a state capital, essentially. So, and what happened was, it's like working, so I could understand those nurses as well, right? So nurses like, how do you know about I said, hey, baby, I've been there for 3 years. I worked as a nurse, night shifts.
Oh my
When you have 2 nurses, 4 post-op, with some of them are intubated, but we had an anesthesiologist on duty always, not in the unit, but in the hospital. But that was interesting time. So I learned so much. I learned how to put IVs. I learned how to intubate even before
You're much better at that than probably the rest of us.
Well, I mean, it was just kind of, for us, it was a necessity to make money to survive as students, but it was kind of a, a good fringe benefit.
Yeah, that's amazing.
Yeah. What I was gonna ask you, oh yeah, oh my gosh, I have to ask you before we wrap this up about your running marathons for supporting cancer charities and Ellie, right? Am I pronouncing it correctly? Ellie Fund. So tell me more about it, because you are so dedicated to the cause and you're so passionate and you live what you preach, right? So, but you are to the point of running 10 consecutive Boston marathons for this cause. Can you tell me how you started doing this?
I have not qualified 10 times.
No.
Marathon people have to like be super fast.
Maybe 10 marathons, right?
But yes,
I saw the number 10 somewhere.
My 10th one in April. I do love it. I live here, so the Boston Marathon's like a really big.
Yes, that's true. Right. So I will rephrase 10 marathons for cancer patient benefits of cancer patients. So how did this happen, and how do you train for marathons, and what the fundraising, what are they used for? The funds.
So it's funny, when I was in college here, I remember always telling my friends, I'm going to run the Boston Marathon someday. And they're all like, yeah.
I was like, yeah, no.
So then, and training through the winter here was definitely not fun. But anyway, I guess obviously about 10 years ago, I was like, I'm just going to do this. And, I was working at Mass General, and there's this wonderful team. That year I ran for our hospitals team, which supports research and supportive care for pediatric hematology oncology. And giving a shout out to Dr. Howard Weinstein, who is amazing and started that team in his early 40s in order to get money to support his program for pediatric patients, because it's really hard to get funding, unfortunately, for that population. So he's such an inspiration, and he's done I don't even know, maybe 30 or more Boston marathons at this point.
Oh my God, Boston. He's done Boston marathons?
He does it every year, and I do more than 30 now, and he is.
Hey, you have a way to go.
So
catch up, baby.
But I do love it. And the Ellie Fund, as you noted, it's a nonprofit that I on the board of. I got involved with a few years ago, mostly because I learned about the amazing help they provide our patients. As you know, like when our patients are going through cancer treatment, often these are young women who need help with childcare, transportation, grocery assistance. There's just so many supportive care needs that are unmet, and this nonprofit helps provide these resources to our patients, which is so amazing. For example, I had a young patient who was a new mom with a newborn and about to start chemo, and they helped fund her getting a baby nurse so she could sleep at night as she was going through chemotherapy. And so,
oh my God,
those are just examples of what this nonprofit does. And so therefore, that's why I've been like, I'm running for them. So it's been really such an honor to run to support the Ellie Fund and my own patients who have benefited. So it's just, I love it. So I will keep doing it as long as I can.
You should, yeah. And that reminds me of nonprofit here around Philadelphia. So I belong to the local Chamber of Commerce as Cardioseeds, right? So I met this person and group of people who are nonprofit, and what they do similar things to cancer patients here at the University of Pennsylvania, because Philadelphia has a huge cancer center, and Fox Chase also. So people are referred from everywhere to here as well. And so they provide, literally speaking, they provide living quarters for them, transportation, staying, I think, for like extended periods of time to be close to their loved ones who undergo treatments. Because I had a personal friend who had testicular cancer, the most choriocarcinoma, which was advanced. It was actually one of my daughter's friends, and and he was hospitalized to the Rhodes Pavilion of the University of Pennsylvania for about, I don't know, in and out for 2 years, probably, trying to like get in massive chemotherapies that failed, all of them, then experimental treatment and bone marrow transplant and massive amount of surgeries. I don't even know how many. But if his parents did not live in the area, can you imagine supporting such a kid, right? And so this nonprofit does what you said. Your nonprofit also does. That's amazing.
It's been really,
So
I would say that's another message. I know you work with so many healthcare providers who are experiencing burnout, like getting involved in an organization that you're passionate about. You give your example, or something like the LA Fund. I think it's been really special and rewarding for me to be involved in this way and learn from other people on the board. There's lawyers, accountants, people in business, things I don't know much about. So it's been for me.
Yeah. As I tell my clients, and as I say during my talks about burnout, find your tribe and stick with it, right? That's your tribe. And when people really speak the same language, they do the similar things, and they understand. So you feel like you are committed to something, to a common cause, and you really feel like you are, like a fish in the water, essentially, not fish out of the water.
Definitely.
So yeah. So Amy, before we wrap up today's conversation, I want to ask you, what message you like to leave to our listeners today? What's the final word?
Right. Wow. Well, we've covered so many interesting topics in today's conversation, but I would just say, when thinking about, whether it's a patient or a colleague who's having a hard time and trying to perhaps adopt some of these lifestyle changes that we've talked about in the course of this conversation, it's often very overwhelming and daunting to think about making these changes. But I love this quote from Lao Tzu: "A journey of 1,000 miles begins with a single step." So I'd just like to end with that.
Oh, that's wonderful. What a powerful way to end the conversation today, Amy. And I hope that our listeners, are amazed by the reach impact of your work, and pleased with, learning from you today. And thank you so much, Amy, Dr. Comander, for your time, for your dedication, for your warm heart, and your boundless energy. So, your wisdoms, your insights. Thank you, Amy. And thank you for being here.
Very appreciative. Thank you.
And thank you to all our listeners to be here with us today and later. And please stay tuned to other episodes of the Cardioseeds podcast. Visit our website, listen to other episodes, and see you later. Goodbye for today.